Hi, and welcome to another episode of Hot Takes with me, the Silver Fox. Caring is a very difficult job. It is also a remarkably undervalued and under-rewarded job. Carers typically only earn the minimum wage or slightly above. And yet it is a job of such importance, especially for those for whom they are caring. There is a massive underemployment problem. They can't get enough carers into the system, partially, of course, because of the low wages. But there is another looming problem for carers. Under plans by the SNP government, they are about to pass a law that will criminalise carers if they fail to pass on certain pieces of information. Now, it may be that you don't know about the information itself, you don't know that it needs to be passed on, or you may be thinking in the patient's interest you best not tell anyone about what they have said or done. It may be that maybe the IT system is crashing around you and you are unable to pass on that information. Previously, if you'd failed to put over a piece of important information, maybe there was a complaint made and you don't really feel like you want to say it, the legislation as it currently stands means that you can be disciplined. You could even lose your job. But certainly a hearing, and if there is a reasonable reason for you not passing on that information, then that will be accepted. But under these new proposals, you will be criminalised. You will have a criminal record. Is this going to improve the chances of people going into caring, or make it much more unattractive? You'll have to decide that for yourself. But we're going to take a look at this article because it is shocking that the government are thinking of criminalising people for withholding certain pieces of information. Here goes. So ScotGov bids to create a nightmare state of criminalisation of care staff. Plans for the Scottish Government's flagship care service include a shocking bid to impose criminal sanctions over failure of staff to share sensitive patient information and over the handling of complaints. It can be revealed. You've got a problem where you haven't got enough people in the caring industry, I suppose you'd call it. And then you're going to criminalise them if they make a mistake or if they act in a way that they think is best for the patient. How is this possibly right? How can you criminalise someone for something like that? Anyway, the uncovered criminalisation clauses have been strongly criticised as the Scottish Government seeks to pursue proposals for the proposed National Care Service. In theory, it's an excellent idea, the National Care Service. It runs alongside the National Health Service. It's going to be very, very expensive, so you'll have to look at making cuts elsewhere because you can't tax people even more at this time. But the principle of it, I get. But you can't make criminals out of people like this. It's so simple. You are criminalising people who may be caring. You're going to drive people out of this profession just as you're starting up this care service and need people in. It's madness. Anyway, concerns have emerged that the National Care Service Scotland Bill states that ministers may, through regulations, provide a scheme that allows care records to be shared so that services can be provided efficiently and effectively on behalf of the care service and the National Health Service. And it states that the regulations may create sanctions, civil or criminal, for those who fail to comply. And that's with the information sharing requests. Now, maybe the patient has expressed opinion that he or she does not want certain information shared. If the patient says that and then the carer fails to share it because obeying the patient's wishes, why should the carer then be criminalised? Anyway, it's been described by the respected think tank Commonweal, which has an interest in supporting the care design, as a nightmare state plan for thousands of care workers. Nick Kemp, former head of service for older people and adults in Glasgow and the chairman of Commonweal's Care Reform Group, said, "This enables the Scottish Government to criminalise the workforce when they fail to share information in certain aspects. This has pretty big implications and is of immense concern. It is like Brave New World." He said, potentially, you would be criminalised working in care homes and not giving information to the health board over what is happening to people. Now, if the health board want the information, they can simply go and get a warrant for it. It's very simple. That exists in law now. People should not be forced to say things and forced to give information that may well criminalise themselves. It's a basic protection in law that you, like the Americans, they have taking the fifth. We also have that, where you can refuse to answer to incriminate yourself. But people working in healthcare are registered and covered by professional codes of practice. If they break that code, and that generally includes requirements for confidentiality, but also clauses about when to share or report issues of concern, then they can face professional disciplinary action, including having their registration removed. So there's already protections in there that people have to obey, or they will lose their jobs or their registration or whatever. Why would you go the extra step of criminalising them? Just as you're trying to encourage people to go into caring to fulfil the requirements of the National Care Service. It is lunacy. But of course, this is the SNP we're talking about. We don't expect anything less. Anyway, Mr. Kemp said there are already sanctions in place for people who fail to share information where it's absolutely required. And normally, if you do fail to do something that's required as part of your job, it is the responsibility of employers to address the issues causing this. Someone may be failing to carry out their function due to a lack of training, or because they are overworked, or because they don't have the tools necessary for the job, like IT. And replacing this approach by sanctions, whether criminal or civil, is extraordinary, and there was no consultation with those in the workforce who may be affected before this clause was drafted. They basically put this on, not told anyone, and now people who are carers will see that, hang on a minute, if I do this or something happens, I can be criminalised. Well, I don't want to take that risk. I'm going to quit this job and find another one where I'm not going to be criminalised for something that I didn't do. And then where are you getting your carers? You're running low on carers now. Nobody wants the job now. It's ridiculous, isn't it? Anyway, Amanda Bergauer, I hope I'm pronouncing that right, head of Commonweal, added, to put that much power in the hands of ministers is shocking. How can ministers decide on criminalisation? Nicola Sturgeon said in September 21 that the plans for a national care service will be one of the biggest ever achievements of this parliament, and just like the National Health Service in the wake of the Second World War, it will be a fitting legacy of the trauma of COVID. Well, Nicola Sturgeon, the head of the SNP at the time, would know that everything the SNP does is rubbish. Now, the principle of this care service is great, but you know that in practice it will fail terribly because it was designed by the SNP, and for whom everything has to be seen through a veil of independence. They cannot concentrate on getting the job done and done well without reminding themselves constantly about independence. And so given that, and there's sort of two thoughts at the same time, you know this is going to be an awful, awful service. As of June 25th, there have been a total of 17,695 deaths in Scotland where COVID was mentioned on the death certificate, with 13 in the last week. Among a third are estimated to have occurred in care homes deliberately. They were putting people with COVID into care homes, and that's why the care homes had this massive amount of deaths. Already vulnerable people having this thrown in on them. Deliberate ploy by the SNP to reduce numbers to save on costs, and of course, as the older people tended to be more unionist minded, it would bring the unionist cause further away and bring independence nearer. That was the thinking. That was the cynical thinking that led to what could potentially be a case of murder. The Scottish Government initially said the new service could cost up to 500 million to deliver, but Scottish Parliament researchers have estimated the total bill over the 5 years could be between 664 million and 1.3 billion pounds. And you think it's bad now where they've got £1 billion to make up and they're giving a 22.5% rise in council tax bills. Think how bad it's going to be when there's another £1.3 billion on top of that. Under the changes, adult social care and the potential other areas, including substance and alcohol services, children's services, they would be taken out of the hands of local authorities and given to newly formed regional care boards, which would ultimately be responsible to ministers. And then the ministers could see that so-and-so has failed to pass on a piece of information without knowing why, without an inquiry, and then just criminalise them. Not the courts criminalising them. A minister criminalising someone. It's wrong. It's unjust. It's immoral. And it's damn stupid, because you need people to go into caring, not come out of it. It is unbelievably dim. But then, as I say, it is the SNP. You don't expect common sense or intelligence. I'm coming up. Why should any minister be given the power to criminalise an individual on a whim? Now, the fact is that most of the reasons, and this is borne out by evidence, most of the reasons that there is a failure to communicate certain information at any particular time isn't down to the fact that the care services are filled with people who want to keep secrets, or that they're badly trained, or anything like that. There is perhaps a few of them. You can't say there's definitely not. But the vast proportion of the time is because of IT problems. There are various different systems of IT in the NHS at the moment, and not all of them talk to each other. Some are based on very old technology. Some are running on mainframes from the 70s. Some on, of cloud-based. Some are sitting with servers in a hospital and so forth. They don't all talk to each other. So one of the biggest problems isn't people. It's the systems. And until you make a major infrastructure investment on a singular hospital system, that will always be the case. But it is just clearly wrong. It is absolutely and clearly wrong that any minister should be given so much power that they can just simply criminalise an individual there and then without knowing the facts. It's got to be rejected. Anyway, I shall finish there. Thank you very much for listening. If you like what you hear and see on the channel, please do hit that subscribe button, ring the bell, leave a like, leave a comment, please share a video, and let me know what you think about giving the ministers like Jenny Gilruth the power to criminalise you. Bye.